Jhpiego has been working in India for many years, but in 2009 decided to have a presence and office was started. The area which we started working was on family planning, because we found that the postpartum family planning was missing, and most of the women were using sterilization and only contraceptive was that which was being promoted. So when we started working in the area of postpartum family planning, we found that IUCD was one area where over last 2 decades we find that the use has not gone up to more than 2%. And there was a paradigm shift in the government of India's thinking also, where they were looking at population stabilization as more of a maternal, newborn and child health initiative. So the program, which started in a couple of hospitals in 2009 in UP, now has been taken forward in 19 states, and more than 50-60 facilities now have introduced postpartum IUCD in their program. And we find that almost 50,000 IUCDs have been inserted in the last 2 years, and with very good follow-up findings. There is a realization that we have to improve not the quantity but also the quality of services which have to be given to the women. And they are critically looking at having standardized training for the providers at different level of facilities, a good follow-up, and also making sure that we need to address the postpartum care and not just intrapartum services. However, I think the big challenge that India faces these days is the human resources. The quality at the different health facilities, almost in many states you find, especially the ones which are performing poor, a shortage of manpower in terms of 50%. And the second one is that although Government of India is putting a lot of money in through the National Rural Health Mission into the public health sector, it depends a lot on the governance of the services in that particular state, and there is definitely a mismatch between the amount of money which is being spent on health and how it is utilized, and accountability of the system. So if we can have programs which can improve on two aspects: one, the quality of services being provided to women, and increase the accountability in the system, and using a systems approach, that can definitely improve the services. In terms of maternal health care, if we see what has worked, is definitely more women are aware about having good antenatal care. What has also worked is that more and more women are coming to the institutions for the delivery services. What has worked is definitely you find that the infrastructure support, and in terms of other logistics support, the Government of India is putting more funds. But what has not worked is lack of human resource. What is still a problem is the providers following protocols and standards when they are providing services. And also I think in some ways, because of the overcrowding now in the institutions, they find that they are not equipped to be able to support the influx of patients which is happening, especially at the tertiary care and the secondary care. What we found that when we started working in the pre-service, for strengthening of the pre-service nursing education, we use clinical standards to improve the quality of services at the facility. And we have realized that many times the providers are trained, but since they don't get the support from their other co-workers, they are not able to implement some of those practices. I think quality needs to be institutionalized. That's one thing which we definitely would like to promote. The second is that the women, when they come to the institution, they need providers who can empathize with them, who can provide, some privacy to them, talk to them, provide services which are, sensitive to their needs. I think that is another area which we need to work on. It's not just during the institutional deliveries that you have to take care of the mother, but also the newborn is equally important. A newborn resuscitation, use of certain things like simple things which can improve the quality of training and provision of services to the mother as well as the newborn. The other area which definitely will have a big impact is being able to provide postpartum care to both mother and newborn, and specific to addressing things like how to breastfeed the baby, the maternal nutrition, which is a big problem, talking about the danger sign to the families and the parents about when to bring the mother and child to the facility whenever there is anything, which timely referral. And so all these things will definitely have a better impact on the quality of services being provided, and then will have impact on both morbidity as well as mortality.